Did you know that a single mistake in medicine can sometimes teach us more about our health than years of perfect care? I'm Dr. Mike, and today we're diving into some of the wildest medical mistakes that actually happened, and more importantly, what they can teach us about how to take care of ourselves. In this video, you'll learn how errors in diagnosis, treatment, or even simple communication reveal hidden patterns in our bodies, habits, and decision-making. We'll explore how misread lab results, overlooked symptoms, and even minor surgical mishaps can highlight the limits of human judgment, and why understanding these limits can help you make smarter, safer health choices every day. But this isn't just about shocking stories. We're going to unpack the lessons behind the mistakes, how small habits, mental resilience, and daily routines can prevent problems before they start. You'll discover practical strategies that aren't commonly discussed, how to track your own health data, advocate for yourself with doctors, avoid unnecessary tests, and even use mistakes as a roadmap for stronger physical and mental health. By the end of this video, you'll not only be amazed by some of the unbelievable medical errors that have actually occurred, but you'll also walk away with actionable tips you can start applying immediately to protect and optimize your health. So stick around, because the lessons hidden in these mistakes might just save you from making your own. Welcome to the Dr. Mike channel, where science meets real-life health wisdom. If you haven't already, make sure to subscribe and hit the notification bell so you never miss a tip that can improve your body, mind, and daily habits. Let's get into it. Imagine walking into the emergency room with chest pain only to be told it's just anxiety and later discovering it was actually a heart attack. It sounds shocking, but this happens more often than you might think, even with top doctors. Medical training is incredibly thorough, yet the human brain is prone to pattern recognition, and sometimes the pattern we expect isn't the one we're actually seeing. Symptoms like shortness of breath, dizziness, or palpitations can overlap between anxiety, panic attacks, and serious cardiac events, making even experienced clinicians susceptible to misreading the signs. The lesson here is subtle but powerful. Your body communicates constantly, and persistent or unusual symptoms are never something to ignore. Self-monitoring isn't about paranoia, it's about gathering small, meaningful data that informs smarter decisions. Keeping a simple health journal, tracking heart rate, sleep, diet, stress levels, or symptom frequency can reveal patterns that even sophisticated tests might miss. Over time, this daily attention helps you and your healthcare providers make more informed choices, turning vague complaints into actionable insights. There's also a mental side to this. When a symptom is dismissed or misattributed, it can erode your confidence in your own awareness. By actively monitoring and recording your health, you reclaim that confidence. You become the first line of observation, noticing trends before they escalate. Even small pieces of information, like the intensity of chest tightness or the time of day a symptom appears, can be critical clues. Ultimately, this approach isn't about second-guessing doctors. It's about complementing their expertise with your own consistent, careful attention. In a world full of overlapping signals and human error, the small act of tracking your health daily can make a profound difference. Every note you take, every pattern you recognize is a step toward preventing mistakes before they happen. More isn't always better, especially in medicine. It might seem logical that the more tests, scans, or medications you have, the safer or healthier you'll be. But in reality, piling on interventions can sometimes cause more harm than good. Extra tests can lead to false positives, unnecessary procedures, or anxiety that actually affects your physical health. Overprescription of medications can trigger side effects, interactions, or even long-term dependence, turning a manageable issue into a cascade of new problems. The lesson here is simple but often overlooked. Precision beats volume. Quality always matters more than quantity. The smartest approach isn't to chase every possible treatment or lab result. It's to focus on the interventions that are truly necessary, evidence-based, and targeted. This principle doesn't just apply to medicine. It's a mindset you can apply to life, habits, and performance. When you prioritize focus over frantic accumulation, you reduce noise, stress, and unnecessary complexity, leaving space for clarity and real results. In practice, this means actively engaging with your healthcare decisions. Ask questions like, do I really need this test? Or what will this medication actually accomplish? Don't just accept a prescription or procedure because it's offered. Understanding its purpose, risks, and alternatives empowers you to make smarter choices. You can also build protective habits outside the clinic. Prioritizing sleep, nutrition, movement, and stress management often produces greater benefits than many tests or prescriptions combined. Daily routines that support heart health, immune function, and mental resilience act like preventive medicine, reducing the likelihood that you'll even need extensive interventions. By treating your lifestyle as the foundation and medical care as the precision tool layered on top, you create a system where less can actually be more, and every choice is intentional rather than reactive. Even in the most advanced hospitals, mistakes happen, sometimes in ways that seem almost unbelievable. Surgeries performed on the wrong site, instruments left behind, or simple miscommunications can have serious consequences. These incidents are more common than you might think, but many go unreported. It's a stark reminder that human error is inevitable, even among highly trained professionals. The difference between a minor error and a major disaster often comes down to systems, routines, and active engagement. One of the most powerful lessons from surgical mistakes is the value of checklists and protocols. Hospitals that implement structured safety checks drastically reduce errors. The principle is simple. Humans are fallible, but habits and systems act as safeguards. This idea extends beyond the operating room into everyday life. Developing habits that reinforce consistency, attention to detail, and accountability can prevent small oversights from turning into bigger problems. For patients, this means taking an active role in your own care. Double-check names, dates, medications, and procedures. Don't hesitate to ask questions, repeat instructions, or clarify uncertainties. Getting a second opinion when something doesn't feel right isn't just cautious, it's smart. Engaging with your care transforms you from a passive participant into a collaborator in your own health outcomes. The mindset you cultivate here isn't about fear, it's about empowerment. By combining vigilance with structured habits, you reduce risk and increase confidence. Small actions like confirming surgical sites or tracking medication schedules mirror the checklists used in hospitals and create a personal system of safety. Over time, these habits sharpen your awareness, enhance decision-making, and build resilience, not just in health, but in any area of life where precision and accountability matter. Even a simple prescription can become dangerous if it's misunderstood or mismanaged. Incorrect dosing, taking medications at the wrong time, or combining drugs that interact poorly can lead to severe consequences, sometimes even life-threatening ones. Studies show that medication errors are surprisingly common, and often the result isn't negligence, but small gaps in communication or organization. The good news is that most of these risks are preventable with simple habits and awareness. The key lesson is clear. Understanding your prescriptions and how they interact is essential. Every medication has a purpose, potential side effects, and sometimes interactions with other drugs, foods, or supplements. Taking the time to know these details isn't overcautious. It's proactive self-care. When you're informed, you can spot potential issues early, ask the right questions, and make better decisions about your health. One practical habit to build is maintaining a clear medication log. Write down every prescription, dosage, timing, and purpose along with any supplements or over-the-counter drugs you take. Update it whenever something changes. Bring this log to every doctor's visit and use it to review your regimen together. This small daily practice acts like a personal safety system, catching errors before they escalate. There's also a mindset shift here. Taking responsibility for your medications reinforces discipline, attention to detail, and self-awareness. These habits carry over into other areas of life, from nutrition and exercise to work and relationships. By actively tracking and reviewing what goes into your body, you create a system that minimizes mistakes, enhances your health outcomes, and gives you confidence in your care. Small, consistent actions, like noting a missed dose or a new side effect, can prevent big problems down the road, turning medication management into a daily practice of resilience and mindful health. When you get your lab results back, it's easy to feel reassured by a normal reading. But here's the catch. Lab values are context dependent. What's considered normal for the general population may not reflect what's optimal for your unique body, lifestyle, or genetic makeup. A number that falls within the standard range might still signal early imbalance, subtle stress, or emerging health issues that go unnoticed. This is why relying solely on one-off lab results can be misleading, and sometimes even dangerous. The lesson is simple but powerful. Individualized medicine matters. Health isn't one size fits all, and your body doesn't follow standard templates. Understanding your personal baseline, the range where you feel and function your best, is far more valuable than comparing yourself to a generic scale. This mindset encourages self-awareness, curiosity, and proactive engagement in your own health journey. In practice, this means tracking trends over time rather than obsessing over a single number. Keep a log of your lab values alongside notes about your sleep, stress, diet, exercise, and energy levels. Over weeks, months, and years, patterns emerge. You may notice that small lifestyle adjustments, like improving sleep quality or managing stress, shift your numbers in meaningful ways even before a problem becomes apparent. This approach also changes how you interact with your doctors. Instead of passively receiving results, you come prepared with context, questions, and observations. It turns each appointment into a conversation about optimization, not just disease detection. By treating your lab results as part of a larger, personalized story rather than isolated snapshots, you cultivate habits of observation, reflection, and intentional action. Over time, this practice strengthens not only your physical health, but also your confidence, resilience, and ability to make informed, proactive choices every day. It's surprising how often chronic health issues are treated without fully considering the basics: diet, sleep, stress, and exercise. Even the most skilled doctors can be so focused on medications or procedures that they overlook the foundational habits that actually drive long-term health. Yet research consistently shows that lifestyle factors are often the most powerful determinants of outcomes, sometimes more impactful than any intervention or prescription. The lesson is clear: daily habits matter. What you eat, how well you sleep, how you manage stress, and how consistently you move your body create the environment in which your health either thrives or struggles. Small, intentional actions in these areas accumulate over time, building resilience, energy, and resistance to disease. Ignoring them may seem harmless in the moment, but over weeks and months, small lapses can snowball into significant problems that no medication alone can fully fix. The practical takeaway is deceptively simple. Focus on building small, consistent routines. Start with one habit at a time, whether it's walking for 20 minutes daily, adding a serving of vegetables to each meal, committing to 7-8 hours of sleep, or practicing a 5-minute stress reduction exercise each morning. Consistency is more important than intensity. Small wins compound, creating momentum that naturally supports other healthy behaviors. By integrating these habits into your daily life, you shift the balance from reactive healthcare to proactive health mastery. You reduce the likelihood of chronic issues escalating and create a foundation that amplifies the effectiveness of any medical intervention when it's needed. Over time, these routines don't just improve your physical health, they enhance mental clarity, emotional stability, and overall performance. In short, investing in daily habits is investing in a system that prevents mistakes before they even occur, giving you control over your well-being rather than leaving it solely in the hands of others. Sometimes the source of physical discomfort isn't physical at all. Doctors can treat the body meticulously, but still miss the impact of stress, anxiety, or other mental health factors on physical symptoms. Headaches, digestive issues, fatigue, and even heart palpitations can be strongly influenced or even caused by emotional stress. The mind and body are deeply connected, and ignoring that link can lead to misdiagnoses, unnecessary treatments, or prolonged discomfort. The lesson here is profound. Emotional health is not separate from physical resilience. Stress, unresolved emotions, and mental strain affect hormones, immune function, sleep, and even pain perception. By nurturing mental well-being, you strengthen the body's ability to heal, adapt, and perform. It's not just about feeling calmer, it's about creating a foundation for lasting health. In practice, this means actively including mind-body strategies in your wellness routine. Mindfulness exercises, such as focused breathing or short meditation sessions, help regulate the nervous system and reduce the physiological impact of stress. Journaling allows you to process thoughts and emotions, identify patterns, and gain clarity on triggers that might affect your health. Therapy or counseling provides structured support to work through deeper mental or emotional challenges, translating into tangible improvements in physical well-being. Building these habits doesn't require hours a day. Consistency beats intensity. 5 minutes of mindful breathing in the morning, journaling a few sentences about your day, or weekly therapy sessions compound over time, enhancing your resilience to stress and improving overall health. By integrating these practices, you create a proactive system where emotional awareness supports physical function, helping prevent misdiagnoses and promoting long-term vitality. In essence, caring for your mind is caring for your body, and small intentional daily habits are the most reliable tools you have to bridge the two. Technology has transformed medicine with imaging scans, AI algorithms, and digital diagnostics promising faster, more precise answers. But here's the catch: machines can mislead. A perfectly generated image or algorithmic prediction isn't infallible, and even the most advanced technology cannot replace the nuanced judgment of a trained clinician. Errors can occur when data is interpreted out of context, subtle anomalies are overlooked, or the human story behind the numbers is ignored. The lesson is clear: Critical thinking always beats blind reliance on technology. Tools are only as effective as the mind using them. In healthcare and in life, unquestioned trust in automated systems or expert recommendations can lead to mistakes, misdiagnoses, or unnecessary interventions. The key is to treat technology as a guide, not an authority, and to pair data with observation, context, and personal awareness. For your own health, this mindset translates into practical habits. When you receive test results, imaging reports, or AI-based recommendations, don't just accept them at face value. Ask questions. What does this mean for me personally? How does this fit with my overall health history? Are there alternative explanations? Document your observations, track your symptoms, and compare them over time. This habit of informed skepticism helps you actively participate in your care rather than passively following recommendations. Beyond health, cultivating this approach strengthens decision-making in every area of life. Question assumptions, verify information, and integrate multiple sources before taking action. Over time, this builds a mindset of clarity, discernment, and personal responsibility. By using technology as a tool rather than a crutch, you empower yourself to make smarter choices, prevent mistakes, and maintain control over your well-being, proving that human judgment, supported by consistent habits and thoughtful reflection, remains the most powerful asset in any system. Sometimes the most serious medical problems start with the smallest oversights. A minor infection, an overlooked allergy, or a lapse in hygiene can quietly escalate into life-threatening complications. In hospitals, even tiny mistakes with sanitation or food handling can have massive consequences, and in daily life, the principle is the same. The most effective interventions often begin long before treatment is ever needed. The lesson here is simple but powerful. Prevention is far more effective than treatment. Focusing on small, consistent habits creates a protective buffer against illness and injury. Washing your hands thoroughly and regularly, storing and preparing food safely, and staying aware of potential allergens are all actions that seem minor, but they significantly reduce risk. Similarly, prioritizing sleep, hydration, and immune-supporting nutrition strengthens your body's natural defenses, making it less susceptible to complications. Incorporating preventive habits into your daily routine doesn't require major effort. It's about consistency. Make hand washing automatic before meals, treat sleep as non-negotiable, and build simple checklists for food preparation or allergy management. Over time, these small practices compound, reducing stress on the immune system and minimizing the likelihood of preventable emergencies. This mindset extends beyond physical health. Practicing prevention teaches foresight, attention to detail, and personal accountability. By actively anticipating potential risks and addressing them proactively, you cultivate resilience and reduce the impact of unforeseen challenges. Prevention isn't just about avoiding illness, it's about empowering yourself with daily routines that keep you strong, adaptable, and in control. In essence, the simplest actions, repeated consistently, often have the greatest impact, proving that safeguarding your health is less about reacting to problems and more about building a system that prevents them from occurring in the first place. Rare diseases are tricky because they often mimic common conditions. A persistent cough might be dismissed as a lingering cold, a strange rash attributed to allergies, or fatigue chalked up to stress. Even experienced doctors can misdiagnose uncommon conditions simply because they're less familiar or because the symptoms overlap with everyday ailments. This is why awareness of anomalies, those little signals that feel off, can be a game changer in personal health management. The lesson is clear. Noticing patterns and anomalies empowers self-advocacy. Your body communicates in subtle ways, and when you pay attention, you can spot issues before they escalate. One of the most effective tools for this is a health journal. By tracking symptoms, energy levels, sleep, diet, stress, and any treatments or medications, you create a record that reveals patterns invisible to casual observation. Over weeks and months, trends emerge, helping you and your healthcare providers see the bigger picture. Maintaining a health journal also strengthens your role as an active participant in your care. When something unusual appears, you can present clear, detailed information rather than relying on memory or general impressions. This habit not only helps with potential rare conditions, but also improves the accuracy of treatment for common issues, because context matters. Integrating this practice into your daily life doesn't have to be cumbersome. A few lines in a notebook, a quick note in a phone app, or even a weekly summary of symptoms and lifestyle factors can be enough. Over time, you'll develop a deeper understanding of how your body responds to stress, diet, activity, and environment. By cultivating awareness and recording patterns, you turn small observations into actionable insights, improving both your resilience and your ability to advocate for your health, proving that paying attention to the uncommon can be just as important as addressing the obvious. Medical mistakes might sound alarming, but they teach us something profound about the limits of human knowledge and the power of our own habits, vigilance, and resilience. Every misstep, whether it's a misdiagnosis, a missed symptom, or a small oversight, highlights the areas where awareness, consistency, and proactive action make the biggest difference. The takeaway for you is simple. Start small, track your health, pay attention to patterns, question assumptions, and build daily routines that support both your body and mind. These small, consistent actions compound over time, giving you control and confidence in your well-being. Remember, true health mastery isn't about never making mistakes. It's about learning from them, adapting, and strengthening your habits every single day. By cultivating awareness and intentionality, you transform potential pitfalls into lessons that guide smarter choices, better resilience, and a more empowered life. If you found this video helpful, take a moment to like it and subscribe to the Dr. Mike channel, where we explore practical, science-backed strategies to improve your health, mindset, and daily habits. Together, let's turn lessons from the unexpected into tools for a stronger, healthier future.